All right, so we are in the week of November 2nd through the 5th, covering respiratory system, digestive system, body metabolism. So we'll probably run into next week on digestive system. So this week, you'll have a quiz over respiratory system. Okay, just want to make sure you're aware of that. All right, your exam from last week, I have a few more that I need to look at, and then I'll be able to go over this on Wednesday. So we'll go over exam 4 on Wednesday. So next week, you'll have a quiz over chapters 12 through 14, digestive, or respiratory, digestive, and lymphatic systems. Okay. So let's get into the respiratory system. All right. So what does the respiratory system do? So the respiratory system is involved in gas exchange. Okay, that is its role. All right, so there's anything it does that. It works together with your cardiovascular system so that you can breathe, so that you can perform external respiration or kind of exhaling to the external environment or getting air out and air in, internal respiration going on inside your body, and transport of gases, okay? Moving those gases around in your body.
The screens are not on.
Okay, I guess they just went off. All of a sudden, it's like I saw them on, and then they went off. Hopefully it stays on this time. So, okay. So, I think I know why. Pause the video. All right, so as I mentioned earlier, respiratory systems involved in gas exchange, works in partnership with your cardiovascular system, help you breathe. External respiration, interaction with the external environment, internal respiration, what's going on inside your body, and transporting those oxygen molecules and carbon dioxide molecules, those gases. All right, nasal cavity and the rest of your digestive tract. So from your nasal cavity down to your larynx is considered your upper respiratory tract. Trachea down to your diaphragm is considered your lower respiratory tract. So your nasal cavity helps you, it moistens the air, filters it and warms it. Your pharynx passes way for both air and food. Your glottis is a space between your vocal cords. Okay, it's an opening to your larynx. The larynx is your voice box. Okay, it's gonna create sounds so you can speak. It's covered by your epiglottis when you swallow. Your trachea here, also known as your windpipe, is where air goes. Okay, food's gonna go into your esophagus, right, in the digestive system, and it moves air into your bronchi. The trachea does. All right, from the bronchi, air moves into these bronchus, or an individual bronchus, or plural bronchi. All right, so that's air getting into the lungs. And from there, air moves into bronchioles. So bronchioles are kind of like the equivalent or analogous structure to arterioles, right? So you have arteries, arterioles, bronchi, bronchioles. Okay, and they move air into the alveoli. All right. So the lung has the alveoli, and these are little air sacs, and they're the structure that's involved in gas exchange, okay? Exchanging oxygen and CO2. The diaphragm is actually made up of skeletal muscle, Okay, and it helps you also with ventilation. Okay. So even though it's helping you with breathing, it is skeletal, so you do have some control over it. Okay. People who sing a lot have usually, if they do practice, they have strong control over their diaphragm. Helps them project their voice out. All right, the respiratory tract. Okay, so the air that comes in, you know, I don't know if you know, even though you can't really see air, it's sometimes dirty. Okay, and you need your mucus, your cilia, and your nasal hairs to cleanse it. All right. You also have lysozymes in the mucus, kills different bacteria. All right. You also have, you know, the working of the mucus in the cilia to kind of move your body, move the air, and call that a mucociliary escalator. All right. Your inhaled air gets warmed by blood vessels that are more superficial that line the airways. Air also gets moistened by mucous membranes. All right, let's start with the nose. Okay, obviously nose is part of your respiratory system, and it's how air gets in and air gets out. Okay, it's the only external portion of your respiratory system. Has two nasal cavities, right, for two nostrils. They are lined by a mucous membrane. Structure is called nasal conchae. Increase your surface area, allows you to moisten and warm the air that you breathe or inhale. All right, you also have odor receptors in your olfactory epithelium. Okay, so you can smell, you know, you send signals to your brain that there's a certain smell. All right, here are these conchae: superior, middle, inferior. Okay, those are the conchae, nasal conchae. Here's a frontal sinus, okay, space. Okay, you get headaches there. Sphenoidal sinus, okay, where the sphenoid bone is. This whole area is your nasal cavity. There's your nostril. Structure here forms your hard palate, the top of your mouth. All right, back here you've got the soft palate. Okay, as well as your uvula here on the end, kind of the little flap that you see sometimes in the old cartoons. Okay, here's your tongue, big tongue muscle. All right, here are your tonsils, palatine and lingual. The epiglottis, right? There's that hyoid bone. There's the glottis, larynx, okay, voice box, and your trachea. Okay, now if air is inhaled through the nose, all right, you have this opening of this area called the auditory tube. Air can get down to your larynx. You have this area called the pharynx, which is made up of your nasal pharynx, near your nostril area or nasal cavity. Oropharynx, oral, short for oral or mouth. Okay, and the laryngeal pharynx, okay, near the larynx. Okay, this other area, that's your esophagus, that's where the food will go. Air goes through the trachea, food goes through the esophagus. All right, respiratory system. Also, let's talk about the throat or the pharynx. So it's a connection point between your nasal cavity and your oral cavity with the larynx. Okay, so it connects those cavities with the larynx. It has three parts as we talked about: nasal pharynx, oral pharynx, laryngeal pharynx. Okay, anybody ever had tonsils removed or had a kid that had tonsils removed? Okay, so these tonsils provide a primary lymphatic tissue, and they are your primary lymphatic tissue defense for breathing. Okay, so they help you fighting infection and things like that. All right. air passage and a food passage will cross each other, okay, at the throat. So air passage essentially through the nose, food passage through the mouth. Okay, let's talk about the larynx. So larynx is a passageway that allows air to go between the pharynx and the trachea. That's where your vocal cords are. So to keep food from getting into your larynx, your voice box, or getting down to your trachea, you have the epiglottis. Okay, it's a covering. There's your larynx. Okay. It's your thyroid cartilage, or sometimes known as Adam's apple. There's that hyoid bone. Remember, it's technically not touching other bones, but it's connected to other tissues. There's cartilage rings around the trachea, and you have more of a membranous part of your trachea that's surrounded by that cartilage. Okay, there's a vocal cord or vocal fold, true vocal cord. There's a false vocal cord. There's some cartilage near your thyroid. It's called thyroid cartilage. Okay, here's another view of the glottis here in the middle. These vocal cords. Okay, epiglottis up here, and the base of your tongue. All right. Okay, your trachea, it's also known as your windpipe. And it connects the larynx to your bronchi. Okay. It's ventral to the esophagus, so more toward the front of the body or anterior. It has C-shaped cartilaginous rings on it. And it has a mucosal lining on the inside, so there's lining with mucus on it. And it has epithelium on there on the inside. And that epithelium is pseudostratified ciliated columnar. Remember when we learned about that? We talked about histology, pseudostratified ciliated columnar. Okay, it comes back up again every now and again. All right, and they form that mucociliary escalator. And so it's escalator in the sense that you get things caught with them in that mucus, moves them out so you can get them out of your body. All right, cough them up. Okay, bronchial tree. Trachea is going to divide into your right and left primary bronchi. Okay, so you have the primary bronchi that will branch into your secondary bronchi. And you have 3 secondary bronchi in the right lung and 2 in the left lung. The reason for that is because your right lung has 3 lobes. Your left lung has 2 lobes. Okay. So the secondary bronchi then are going to divide into tertiary bronchi, okay, which will then feed into bronchioles, which are the smallest conducting airways. All right, so before we go into lungs, let's take a break and talk about the structures in the respiratory system that you've learned about so far. And you can do this at home as well. All right, let's talk about the lungs. So they're paired in the sense that you have 2 of them, and they're kind of cone shapes, okay? They kind of point at the more superior side, or toward the top of your body. Each lobe of the lung is divided into lobules. And each lobule has a bronchiole that serves many alveoli. Okay, so the bronchiole is just sending air to the alveoli. You can send air to multiple alveoli. Another term we use is pleura or pleurae, which is plural. And so it's a double-layered serous membranes. Remember we talked about body membranes a few chapters ago. So one of them was serous membranes. So the visceral pleura is going to adhere to the surface of the lung. The parietal pleura is going to line the inside of the thoracic cavity. So basically what that means is it's a covering over the lung, okay? And it's two layers. So the layer that actually touches the lung is visceral. The layer that touches the thoracic cavity around the lung is parietal, okay? And it produces serous fluid, okay? Which helps to lubricate the lining of the lung. All right, let's move on to the alveoli. So the alveoli are made up of these alveolar sacs, and they have simple squamous epithelium on them. And they're surrounded by those capillaries that we just mentioned. Okay, that's how they interact with the cardiovascular system. Okay, simple. Remember, how many layers is simple? One layer, right? Okay, squamous. What shape is squamous? It's square, flat. Okay, so not to be confused with cuboidal, right? So they're not three-dimensional cubes. Okay, it's more of a flat structure. Okay, and this is where the gas exchange happens. Okay, so the alveoli have to stay open so they can receive air, right? So if they flatten, can't put air in them, right? So, or if they're constricted, you can't, so it's like a balloon. If the balloon, if you hold the ending, you can't put air in it. So material we call surfactant lowers surface tension of the water that lines your alveoli, and it prevents them from closing completely. Okay, which is great because you don't want your alveoli closing completely. You want them to stay open so you can get air in them. All right, respiratory distress syndrome happens when you have premature infants and they're not able, they either don't have or not able to make surfactant. Okay, so that means their alveoli are going to close up and they're in respiratory distress at that point, right? Because they can't get oxygen. Okay, so here is a image. So here's your pulmonary artery. All right, so remember pulmonary artery, blood's coming, remember arteries away from the heart, right? So the artery is pumping blood away from the heart to the lungs because it's pulmonary. Okay, then you get to this arteriole, and it's going to have a lot of carbon dioxide, not, a high concentration of carbon dioxide, low concentration of oxygen. All right, because it's going to the lungs to get oxygen. Goes in this arteriole, goes to the capillaries. All right, and these capillaries surround the alveoli. All right, and the alveoli you've inhaled, so those alveoli have a high concentration of oxygen, right? So oxygen is wanting to go out of the alveoli into the capillaries, okay, because it's going in the direction of its concentration gradient, high to low, right? Carbon dioxide concentration is higher in your pulmonary arteriole. So it's going to leave the arteriole and go into the alveoli so you can exhale it out of your body. Okay, so now here in these pulmonary venules, now you have high concentration of oxygen and low concentration of carbon dioxide. And these pulmonary venules will feed into the pulmonary veins, which will go back into the heart, okay, with oxygenated blood. All right, so let's take a break, talk about the lungs and the alveoli with your partners. Let's go ahead and do that now. All right, so let's talk about a concept known as a respiratory membrane. So it's helpful in facilitating quick exchange of gases. And it's made up of alveolar epithelium and capillary epithelium. Okay, it's really thin, so you can get exchange across it, but it has a large surface area, so you can maximize exchange. All right, but essentially that meeting up of the capillary membrane or capillary epithelium and the alveolar epithelium forms the respiratory membrane. All right, so here's your respiratory membrane. It's made up again of the epithelium from the alveoli, your basement membrane kind of connecting the epithelium and the alveoli to the epithelium and the capillary. Okay, but all three together forms your respiratory membrane. Okay. All right, let's talk about breathing. So breathing involves what we call ventilation. And it's basically how air gets into your lungs and how air gets out. So things you got to consider or think about when it comes to ventilation include the fact that the lungs are within a thoracic cavity, which is said to be sealed off, right? It's not, directly exposed to the outside of the body. The lungs are also going to connect or adhere to the wall of the thoracic cavity because of that parietal pleura we just talked about. Also, you get a continuous column of air that's going to extend from your pharynx, okay, in your throat, down to the alveoli in your lungs. Okay. All these things are going to affect your ventilation. Okay, inspiration. So inspiration is the active phase of ventilation. It's considered to be active. You have to push or do some effort to inhale. Inspiration is also what we generally call inhalation or inhaling. So the diaphragm here is going to contract and flatten. Okay. And if you think about it, contracting and flattening for the diaphragm, which is below your lungs, if it flattens, it gives your lungs more room to take in oxygen. Your external intercostal muscles contract. Anybody remember where intercostal muscles are? They're in the ribs. Okay, so your external rib cage muscles are going to contract. Okay, and your rib cage moves upward and outward. Okay, again, making this space bigger so you can take in oxygen. Your thoracic cavity volume is going to go up. It'll increase. Okay, it allows your lungs to increase their volume. Also, air pressure inside of the alveoli is going to go down. Okay. And air is going to flow from an area of high pressure, what we call atmospheric pressure, to an area of low pressure, which is inside your lungs. Okay. So again, with that intrapulmonary pressure in the alveoli going down, you create a pressure gradient, which moves air into your lungs. So it's not just that you're inhaling, but when you're inhaling, what you're also doing is creating a pressure gradient, which drives air down into your alveoli. So, and even if that doesn't make complete sense, know that there's a pressure difference between the air that you're breathing outside of you and the pressure inside your alveoli. Okay, and that drives air into your alveoli. Okay, so this kind of shows what happens during inspiration. Rib cage is going to move up and out. Okay, your external intercostal muscles are pulling those ribs outward. Diaphragm contracts, moves down. Air goes in, pressure in the lungs decreases, air goes in because the pressure inside is lower than the pressure outside. Okay, so that forces air in. Now, what about expiration or exhalation? So this is typically considered passive. Here, the diaphragm's relaxing. Okay, it goes back to its dome curved shape. Intercostal muscles in the ribs start relaxing. Rib cage goes down, moves inward. You see a decrease in your volume in your thoracic cavity. Your lungs start recoiling. Lung volume starts to decrease at that point. And you also see an increase in the intrapulmonary pressure, which again is going to push air out. And since the intrapulmonary pressure is now greater than your atmospheric pressure, air goes out. Okay? Expires, it leaves. Okay? So here in expiration, rib cage moves down and in. Okay, and let's do the intercostal muscles, pulling the ribs inward. Okay, and so the external intercostal muscles are relaxing, and internal intercostal muscles are actually contracting and pulling the muscles in for a forced expiration. Okay, your diaphragm relaxes, moves back up. Okay, you have pressure in your lungs increasing, which forces air out of the lungs. All right. So let's take a break and talk about inhalation or inspiration and expiration with your partners. You can do this at home as well. Okay. So let's talk more about the mechanism of breathing. So you've got what we call the maximum inspiratory effort. This involves accessory muscles, okay, that can assist with respiration. Muscles like your rectus spinae in your back, the pectoralis minor, and the scalene and sternocleidomastoid muscles, okay? And these can help increase the size of your thoracic cavity larger than what it would be normally. Okay, you also have forced expiration. You'll see this during heavy exercise, also people that sing, okay? They can sing for a long time without breathing. All right, involves contraction of your abdominal wall muscles, okay? Allowing them to do that. All right, a machine or instrument involved in studying respiration is the spirometer, and it records the volume of air that's exchanged during breathing. Now, to actually show the measurements recorded by a spirometer, you can use what we call a spirogram. Okay, so it's kind of like there's the instrument, and then there's sort of like the printout or the graph, okay, that it creates. All right, so here's a picture. Here's a person using a spirometer. Okay, this is the actual instrument. Okay, measuring their breathing. This is the spirogram. Okay, it's what the measurement or what that measurement looks like. Okay, so if you plot that on a graph. All right, some terms you need to know related to respiratory volumes. Here's the tidal volume. This is normal, everyday relaxed breathing. It's about half a liter. Okay, here's your tidal volume. Okay, that's your normal breathing. Your vital capacity is your maximum amount or volume of air you can inhale, plus the maximum volume of air that you can exhale. Okay, depends on some other factors like your inspiratory reserve volume, which is forced inspiration, forced breathing in, increases your volume of air beyond what you would normally get in tidal volume by almost 3 liters. You also have the expiratory reserve volume, or forced expiration. You're increasing the volume of the air you expire or exhale, and that's about 1.4 liters. Okay, so if you go back up, here's your inspiratory reserve volume, forced inhalation. Okay, here's your expiratory reserve volume, that's forced exhalation. Your residual volume is the amount of air that you have left in your lungs after your forced expiration. It's around 1 liter. So you don't force all the air out. You still leave about 1 liter of air in your lungs. Okay, and that's this area right here. Okay, so normal tidal volume, forced inspiration, forced expiration. What's left? Residual volume. Okay. Add all those numbers together, that's your total lung volume. Okay, and you add your tidal volume, your inspiratory volume, reserve volume, and your expiratory reserve volume, you get vital capacity. That's the total amount of air you can breathe in and breathe out. Okay, that's your vital capacity. Okay, so what is said to control ventilation? Well, it's controlled by what we call a primary respiratory center. It's housed in your medulla oblongata. Okay, remember when we learned about medulla oblongata in the nervous system? All right, yes, you remember, kind of, sort of, you remember that, okay? So, phrenic nerve will actually carry impulses to your diaphragm. And the intercostal nerves stimulate your external intercostal muscles. Now, just your normal everyday breathing rhythm also is going to require input from the pons. Okay, so parts of your nervous system are interacting with your respiratory system. So we've already seen respiratory system interact with the cardiovascular system, right? With the capillaries, right? We saw that. Now we're seeing respiratory system interact with the nervous system. Okay. Okay. So here's showing you the respiratory control centers in the medulla oblongata and the pons. Okay. So here's some motor pathways sending signals to the lungs. Okay, via.
Like with your vertebrae too. My aunt just broke or fractured her either C1 or C2, and they said that had it like broken completely, she would have died because it would have made her diaphragm not work.
Yeah, so if you look at where essentially where the phrenic nerve is coming out, it's technically not necessarily in the cervical area, but depending on how high this is, it can destroy that connection to the primary respiratory system. Okay. And that could affect how well the phrenic nerve works. Okay. Now, there are also inhibitory signals. Okay. It's, inhibit your breathing. Okay, via the vagus nerve. All right, so your breathing can be influenced by nervous input and chemical input. We've already talked a little bit about nervous input, but nervous input can influence the depth of your breathing, how deeply you breathe, as well as the rate, how quickly or how slowly you breathe. Okay, so that can be influenced by your limbic system, your hypothalamus, your cerebral cortex, other brain centers. Okay, you can also have chemical input. Okay. So your respiratory center is going to be sensitive to your concentrations of hydrogen ions and carbon dioxide. Okay, hydrogen ions is one way to measure acidity. Okay, if you remember that from pH. Right? You also have chemoreceptors in your carotid and aortic bodies, and they are sensitive to the level of oxygen in your blood. If you remember the carotid arteries and the aorta, aorta obviously. So depending on what the level is of oxygen in that blood, can stimulate how quickly or how slowly you breathe. So if you think about it, if you have a high rate of oxygen, you may not necessarily need to breathe as quickly, but if you have low oxygen in your oxygenated blood, you're probably going to signal to your body to breathe more quickly so you can get more oxygen. Okay, talk a little about gas exchange and transport. Beginning of the chapter or this presentation, we talked a little bit about external inspiration and internal respiration. So external respiration is basically where you exchange gases in the lungs. And so this happens between the air and the alveoli and the blood in your pulmonary capillaries. So that's external respiration. Okay. So you're actually exchanging the gases. Okay, so oxygen, it's going to have higher concentration in the alveoli because you just inhale air. And it's going to diffuse from the alveoli into the blood, high concentration to low concentration. Carbon dioxide, on the other hand, is going to have a higher concentration in your blood. And it's going to diffuse from the blood into the pulmonary capillaries, into the alveoli. All right. So there's gas exchange. Another term you need to know is partial pressure. The amount of pressure is exerted by each gas. It's going to be symbolized as your PO2 and PCO2. So your alveolar PO2 is going to be higher than what you'll see in the blood, right? Because that's where oxygen, it's going to, you're getting your oxygen through your alveoli. Now, internal respiration, on the other hand, is exchanging of gases in your tissues, okay? So there are still gas exchange, but external is the gas exchange at the lungs. Internal respiration is gas exchange at the tissues. Okay, so it happens between the blood and the systemic capillaries. Remember your systemic circulation and the tissue fluids. So here the oxygen concentration is going to be high in the blood, right? Because it's oxygenated. And it's going to diffuse from the blood into the tissue's fluid. Carbon dioxide, on the other hand, it's going to be high concentration in the tissue fluid. And it's going to diffuse from that tissue fluid into the blood. All right, and your partial pressure for oxygen, or PO2, in your tissue fluid's lower than what it is in the blood, typically, because that's your blood is going to be oxygenated. All right. So here again is a chart of your external respiration. PO2 in the alveoli is higher than it is in the blood. Okay. CO2 is low, whereas in the pulmonary artery and the capillaries, you're going to have a high concentration, okay, of CO2, low concentration of oxygen. And I will differentiate. This is basically air. Here's expired air, here's inspired air. So it's the air you're breathing. All right. But the air in the alveoli it's not as high. The oxygen concentration is what you're inhaling, but still high. Okay, it's still obviously higher than CO2. Okay, now if the gas exchange happens, now your oxygen concentration, O2 rich blood, you have a high concentration. It's very similar to what it was in the alveoli. Okay, and you've gotten rid of some of the CO2. Goes back to the heart, goes through the systemic circulation, goes to the tissues, where the tissue fluid has a low oxygen concentration and a high carbon dioxide concentration. Okay, you have internal respiration there, gas exchange, oxygen goes to the tissues, carbon dioxide goes to the blood. It returns back to the heart. Now you have deoxygenated blood, low concentration of oxygen. All right, high concentration of CO2. Goes back to the pulmonary circulation. Okay, you're going to be getting rid of the CO2 that goes from the blood capillary into the lungs. Okay, goes out. All right, finer point, concentration of oxygen is still typically, even with expired air, it's going to be higher than the concentration of CO2, but it's not as high as it was in inspired air, okay? Because some of that's going to the tissues. All right, so let's take a pause, talk about internal and external respiration. You can do this at home as well. All right, let's talk about oxygen transport. Oxygen gets moved around your body or through your bloodstream through the red blood cells, and specifically it's carried on hemoglobin molecules. So when hemoglobin combines with oxygen, you form oxyhemoglobin. All right, and then when hemoglobin releases its oxygen, it's called deoxyhemoglobin, okay? And you have a little bit of your oxygen transported in the plasma, but most is transported through the red blood cells. All right, now you're also gonna have transport of carbon dioxide as well, right? And that's again is going through your bloodstream. So with carbon dioxide, that is actually going to be in your blood plasma as well as the cytoplasm of the red blood cells. Okay. But not on, typically with the exception of this combined with the globin portion of hemoglobin, which forms carbamino hemoglobin. Okay, so some of it's there, but you see more of it in the blood plasma than you do with oxygen. So most of your carbon dioxide is going to be carried as what we call bicarbonate ions. And here, to get the bicarbonate, you combine carbon dioxide with water. And then you form carbonic acid. The carbonic acid then is going to dissociate into hydrogen atoms and bicarbonate ions. Okay. Excess hydrogen ions are going to combine with the globin portion of the hemoglobin, form what we call reduced hemoglobin. Bicarbonate ions will diffuse out of those red blood cells and go into the plasma. So it's a lot there. So let's see. So basically what we're going to have is CO2 plus H2O and again, it's going to give us H2CO3 or carbonic acid. Okay. So then the we'll do it this way. H2CO3 is going to dissociate into H plus and HCO3 minus. Okay. H plus combines with hemoglobin. Bicarbonate diffuses out of the red blood cell, goes into the plasma. Okay. But that's so what we'll do is we'll put hemoglobin and I'll put it, all right, do it that way. And then I will move this down there. Okay. I don't know, you can't really see it. All right. So all right. So yeah, so that's basically what's happening there. All right. That's what happens to your carbon dioxide in the bloodstream. Okay, now can't talk about H plus without talking about pH, right? So respiratory system regulates your pH. And also we talked about bicarbonate. So you have the bicarbonate / carbonic acid buffer system is affected by your breathing. Okay, now remember, hypo means low, hyper is high. Hypoventilation, it's going to mean you're going to have kind of lower ventilation, and that's going to increase your CO2 levels, okay, in your blood. It's going to decrease your pH, make it more acidic, right? Because that CO2 is going to combine to form carbonic acid. The association of those hydrogen ions makes your pH go down. And you get to acidosis, which means you have a pH less than 7.35. All right, hyperventilation means more rapid breathing or more breathing. You have decreased CO2, okay, which increases your pH. And you get alkalosis, okay, more alkaline or basic, makes your pH greater than 7.45. Remember, 7.35 to 7.45 is kind of your normal range for pH in your body, right? All right, so let's talk about some health implications of the respiratory system. All right, anybody heard of anybody getting an upper respiratory tract infection? Okay, so it can spread from those nasal cavities into the sinuses, can go into the middle ears, can also go into the larynx. All right, viral infections of viruses can actually lead to secondary bacterial infections, right? Because it's kind of making your body weaker, more susceptible to infection. So the virus can do its thing, and then bacteria can come in after that. All right, or bacteria that you normally would have been able to fight, you're not able to fight. Strep throat. So it's a primary bacterial infection. So it's caused by bacteria. That bacteria is Streptococcus pyogenes. All right. So, and it can lead to a more generalized upper respiratory infection. Okay. So if you want to take microbiology here, you can learn more about different kinds of bacterial infections. All right, another health implication is sinusitis. It's an infection in the cranial sinuses, okay? And it's gonna happen when nasal congestion starts blocking the openings to your sinuses. Remember, like the frontal sinus, sphenoidal sinus. All right, so symptoms of sinusitis include what we call post-nasal discharge, or kind of that runny nose, facial pain, okay? Treatment, it's going to depend on restoring proper drainage to those tissues, okay? Or those sinuses in particular. So you got to be able to drain, get all of that congestion out of the sinuses. Okay, otitis media. All right, bacterial infection that happens in your middle ear. And it's often seen in children that have a nasal infection. So again, we talked about things spreading from the nasal cavity into the ear. Okay, pain is what's most noticeable here. You may also see a sense of being full, not, like not hungry. Okay, loss of hearing, vertigo, kind of having balance issues, fever. And it's typically because it's a bacterial infection, you can treat it with antibiotics, okay? Remember, antibiotics work against bacteria, not against viruses. Tonsillitis, and it's an inflammation of the tonsils, okay? Remember, itis is inflammation. When they become inflamed, they also get enlarged. Potentially, a person may have to get a tonsillectomy, which means removing those tonsils surgically. Okay, laryngitis. Okay, inflammation of the larynx, right? Itis is inflammation. A person may have hoarseness, and it can give them an inability to talk in an audible voice. Can't hear them. Okay, could be overuse, could be the reason for it. Could be upper respiratory infection. Okay, in the lower respiratory tract, right, you can see things like bronchitis. And it's a bacterial infection of those primary and secondary bronchi. It's typically going to be preceded by some sort of viral infection. Okay. Now, pneumonia could be viral infection or it could be bacterial infection in your lungs causing pneumonia. All right, and your bronchi and your alveoli start filling up with a very thick fluid. Okay, and risk factors here could be things like getting older, having a weakened immune system, smoking can lead to pneumonia, being immobilized, okay, where you can't move. All right. It could also be widespread or it could be localized just to certain lobules in your lungs. Okay, tuberculosis. So tuberculosis is going to be caused by bacteria. Okay, it's a tubercle bacillus. And lung tissue is going to start developing tubercles or little bumps around the pathogens that are getting in. And we have to do a TB skin test to detect if a person's ever been exposed to it. Okay. All right, so here's your pneumonia again. Alveoli filling with pus and fluid, difficult to exchange gases, hard to breathe. Right. Okay, bronchitis. Infection causes inflammation of the bronchioles. Asthma. Airways get inflamed, they get irritated. Bronchioles can constrict, have muscle spasms. And emphysema, typically associated with smoking. Alveoli burst and fuse into air spaces that are enlarged. You get reduced surface area for gas exchange. Okay. Tuberculosis, you get these tubercles or bumps, and they encapsulate the bacteria. You get reduced elasticity of your lung tissue. Okay. All right, you also have restrictive pulmonary disorders. You get reduced vital capacity, lungs lose their elasticity, okay, not able to stretch and recoil. You have pulmonary fibrosis. Here the fibrous connective tissue starts building up in your lungs, okay? Your connective tissue in your lungs isn't really supposed to be fibrous, right? It's supposed to be able to be flexible. And can be caused when you inhale things like silica or coal dust, asbestos, clay, flour, cement, fiberglass, okay? So this can be an occupational hazard in some industries. All right, obstructive pulmonary disorders. Okay, air doesn't flow freely in the airways. All right, you get increased exhalation time and inhalation time. So it makes it, you breathe more slowly. All right, chronic obstructive pulmonary disorder or COPD can develop slowly or it can develop quickly. But it typically is going to develop over a long period of time. All right, but it typically happens slowly. All right, and it is recurrent, so you never really get rid of it. It can go away and come back. Okay, you have chronic bronchitis. You have inflamed airways filled with mucus. Bronchi have degenerative changes. Again, emphysema, it's incurable. Okay, reduce the surface area for gas exchange. Okay, exhaling is difficult. Okay, you get less oxygen to the heart and the brain. Okay, asthma, get breathing or wheezing, breathlessness. Sometimes you get cough. All right. It's not curable, but it is treatable. Okay. Lung cancer. All right. You get thickening, calcium of the cells in the primary bronchi. Cells with atypical nuclei. We're going to start appearing in the lining that's calloused. All right. Cells start breaking loose, metastasizing other tissues. All right. A procedure called the pneumonectomy is a surgical removal of a lobe of the lung, or sometimes you may have to remove an entire lung. All right. So this shows you the lung cancer, a cancered lung. Okay. All right. So this is what the lung's supposed to look like, and this is what it can look like after getting a lot of tar and cancerous tissue. All right, we'll finish up real quick here. I know we're at time. So aging, respiratory fitness decreases as you get older. Typically you have lower breathing capacity. Gas exchange is less efficient. You get a thickening of the respiratory membrane, which makes gas exchange more difficult. You get less ciliated cells in your trachea. Okay, so you can't capture all of the things that get in into your air supply. Okay, you get more common respiratory diseases. All right, homeostasis. All right, so homeostasis is involved in gas exchange, keeping your gas levels at where they need to be, regulating your blood pH, whether it's too high or too low, controlling your blood pressure, whether it's too high or too low. Also, protecting you against foreign invaders, okay, keeping you well. All right, well, that is the respiratory system. Next video, we will start the digestive system.